All this is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. A little earlier today, because we have a superstar once again. We always have superstars and rock stars. She's a doctorate in nurse practitioner. She is Dr. Eliana Aaron. She has actually joined us from Israel. So you know that, and Eliana, please, my apologies if I am not pronouncing correctly. I try to pronounce as closely as I can. So you can correct me if you like. And so we have been, Cool Beans, we have been discussing about Israel and Israel's vaccination program and how well it is going. Or there have been some Cool Beans sending me messages that, hey, we don't want to be vaccinated and they are forcing us to be vaccinated. Then there are questions sometimes to me that they are creating a segregation and they are creating green passports and they are just not taking care of our rights. So I wanted to make sure that someone from Israel can actually chime in and discuss with us what is happening, so we can actually hear firsthand what is happening there instead of just reading from news. And the problem with the news nowadays is that news have their own biases. So with this, please welcome Dr. Eliana Aaron with us. Doctor,
Thank
welcome.
you. Thank you very much. I appreciate it.
You're welcome. So I'm very quickly going to introduce her. She is an overachiever, as have most of my guests. And so let's introduce her and then we'll start our questions. What we'll do is this, we'll structure our discussion in two parts. First, I want to understand generally about the vaccination program, how's it going, the impact of that, and then the green passports and the mutants and those. So a general structure of the basic curiosities that we've been having. After that, we'll have some questions from our live chat here on YouTube and Facebook, and we'll have some questions from Twitter as well. And once again, it is late in Israel. She tells me that she actually continues to work till 2 a.m. She looks at the data for the vaccination and for the COVID, and then processes that and then presents that. This is amazing. I would like us to stay focused on the vaccination programs and things around that. So I humbly request you to ask your questions in that area. And secondly, please don't mind me when I skip over those questions that are not related to vaccination and this agenda. So let's start. I'm going to very quickly share her bio. So Dr. Eliana Aaron is a US-based, US board-certified nurse practitioner and Israeli nurse with over 20 years of experience as a healthcare provider and healthcare coordinator. So she's a coordinator as well. For 8 years, she was the medical officer of the US Consulate General New Embassy in Jerusalem. So for 8 years, medical officer. I love these great credentials. And among other duties was pandemic planning, health policy development, public health, epidemiology, and emergency medical planning for the Near East region in collaboration with the local authorities and the US Department of State. Beautiful. During her doctoral studies at Yale, so talk about overachievers, PhD from Yale, Dr. Eliana Aaron focused on health policy and gaps in healthcare delivery in the Israeli healthcare system. After graduating from Yale University, Doctor of Nursing Practice, Yale University's Doctor of Nursing Practice program, specializing in health policy, leadership, and management. She founded EMA Care, a healthcare company established to close the existing gaps in the Israeli healthcare system. Again, I think we have the right person to ask our questions. In 2020, when the COVID-19 pandemic began in Israel, she noted the fake news, the overwhelming onslaught of information and news, the fake expert analysis that provide confusing, conflicting, and unhelpful information to people. I would add that even sometimes fear-mongering and even sometimes creating so much of anxiety that people just do not know what to do and where to go and who to trust. Dr. Aaron, who has also been adjunct professor of nursing and lecturer for 17 years in many subjects, including epidemiology, started the first English language COVID website in Israel and daily COVID-19 WhatsApp updates to provide the English-speaking population with accurate information. Isn't that, she's a cool bean as well. Explanations, understanding of fake news versus real news, and epidemiological information. Her groups now have thousands of followers. She has coordinated with Israel Ministry of Health regarding issues for the English-speaking population, consulting in epidemiology graph development, and advocates for the non-residents in Israel. Beautiful credentials. Thank you very much for joining us. So as I have stolen your thunder, I would once again come to you and say, please tell us a little bit about yourself. Anything you would like to add, especially in context of vaccination and the current situation?
I think Israel is a very unique place to be experiencing this, because as a small country, every little thing sort of affects us more, because it's again, the country is about the size of New Jersey, and we only have just over 9 million people, and there's pros and cons. So we've been very much very monitored among ourselves as a population, not even as a health provider, but we know, oh, this guy has it and that guy has it. It's very close. So even early on in the outbreak, we were very involved. And I think at the beginning, the news that was coming out, like you said, exactly what happened in America as well, although America was a few weeks behind in terms of the caseload, is we got a lot of news reporters who don't really understand epidemiology, don't understand public health, and creating panic and not understanding the data. And I really wanted to bring that out to the English-speaking population in Israel, and to help people, not only with information, but also um, to get people the accurate information, and to help provide policy development for non-citizens or non-Hebrew speaking citizens in Israel. So that's really what I've been focusing on, in addition to my regular job. So this is like, all the extra.
Excellent, excellent. Thank you very much. Actually, I just received a question. It's not the time for the questions. I wanted to go over the agenda, but something that is kind of in the same line. I hope so. So Steve just said so Stephen Westman, what is being done to help the near century indigenous Palestinian population with the pandemic? So I'll generally ask Palestinian, Arabs, or the whole population. Again, I have no idea how exactly the policies are. So any comment on that?
So regarding there's two different questions in that. The Arab population in Israel has had access to the vaccine from the very first day it was available, and a lot of efforts have been made to have accessibility in those populations. All of the websites have been in Arabic. There are advertisements in Arabic, and every time there's news or promotions to get vaccines, it's always in several languages, including Arabic. And that's really for the Arabic speaking population in Israel, which is about 20% of the population or so. And the program has been growing in success there. They're still lagging behind a bit, but that is not necessarily because of lack of accessibility. It's because of some hesitancy, which we're getting in actually the ultra-Orthodox and Arab population. So the ultra-Orthodox Jewish and the Arab populations are both a little bit more delayed from the mainstream population. And that's just that they're not early adopters, really. And they were sort of waiting and seeing, and we're seeing now a growth of vaccine rates in those populations, and we're very happy to see that. In terms of the Palestinians who live in the West Bank, Gaza, and that type of thing, that's not Israeli authority anymore. But I do know that Israel started vaccinating. They provided thousands of vaccines to the Palestinians recently, and specifically for healthcare workers. And this past week, we started vaccinating Palestinian workers who come into Israel. And there are other programs in place where we're going to be providing them with vaccines, because Israel got a lot of Moderna vaccines that we're not using. And we're going to be transferring those over to the Palestinians as a humanitarian benefit, because really this is one world and we have to live together, and we need everyone to be safe.
And I love Moderna vaccine. If I wanted a vaccine, that would have been Moderna. So they are getting the good one. So
there you go.
So if I can very quickly go over the current numbers that are on the Worldometer. I'm sure that you have better numbers and you have more accurate number. I wanted to just show this, and we have been for days now looking at Israel's numbers. The reason is that I actually think that this was a very When I read that in the beginning, that Israel had said to vaccine companies that give us a sustained, reliable supply of vaccine, and in turn we will share data with you. I thought that they had done such a beautiful thing. Number one, they took care of their population by prioritizing them to say, get us the vaccines. And secondly, they are now helping the world as well by saying, okay, we'll share data with you that will be
Hmm.
useful. So
Absolutely.
I have been looking at the numbers with Cool Beans here. So just want to quickly see this, and I'll tell you something that I continue to think about, and that is this one. So here, if you see, this is the daily new cases. And again, I'm totally happy to be told that these numbers are incorrect or the context is different to look at them. But see here, even after so much of vaccination, almost 40% of the population two-dose vaccinated, this number of new cases is not going down. Even
Hmm.
without vaccination, there was a better daily case number dip here. And secondly, I love this part that the overall there is a drastic reduction in the new cases. And then, of course, the death rate is still following, and it has without vaccination it had been down, and here with vaccination we are still up. So this is my own curiosity that I would request you to talk about at some point.
Absolutely.
So let's start with this. Let's ask you about the vaccination program itself. Tell us what is
Sure.
happening.
So I want to just show you, um, I'm going to show you a graph. It's a graph of the Ministry of Health, actually, but I think it will help. And I'm going to ask for, you're on my screen? Okay, great. Okay, so as you can see, this is the Ministry of Health. This is in Hebrew. I'm going to just explain it. These are the dates. This is European dates, so it goes day and then month. Basically, our vaccination program started right here. Okay. Um, the second vaccine for the first group, remember, this is a rolling vaccine. It's not like everybody in the country got a vaccine on one day. This is a rolling vaccine process, and it did start with the elderly. So we started off over here. And then the first group of people, I was in the first week of the vaccine program. I'm a healthcare provider, so I was able to get it. That first group peaked right here at the peak. We got our second vaccine right around here. This is day 7 after the vaccine, and then the numbers started going down drastically. The difference is this, if you don't understand the context epidemiologically of what's going on, it makes it very tricky. You could stop sharing the screen if you would like. And it makes it kind of tricky to understand what we're looking at. But actually, there was a completely new variant going on in America. So right now, um, what we were dealing with for the first year of the vaccine of COVID, basically, the first 10 months, let's say, was the regular routine COVID strain. And then all these mutations started happening, and we were dealing all of a sudden with the British variant. And the British variant on January 3rd, we only had 10 to 20% of that variant was going on. So if we look at those numbers again, I'm going to show you a different screen. Hold on, I just want to make it a little bigger. Here we go. So what you can see here, this just goes by month, but what you can see is the very beginning, we had 10 to 20%. And then a couple of weeks later, we were at 70%. And then by the very beginning of February, 90% of the cases in Israel were the British strain. So the British strain is
Wow.
completely, yeah. So this is actually looking, so as we know, the critical cases and the ventilators and the hospitalizations, that's all delayed. So what you actually have here is somewhere around here, about 90% of the cases in Israel were the British strain. And this had a completely different, you could, if you want, you could stop sharing it. What we did is we ended up with a whole different monster. While we were dealing with the first vaccine groups coming out, we had a variant that we were dealing with, and that variant has a 70% higher contagion rate. Let's say it's much more contagious than the original, so it was spreading much more quickly. It was affecting young people all of a sudden, much more than we ever suspected.
So this was the question I had. Sorry for the interruption.
Sure.
Was it that the new variant was spreading fast, or was it failing the vaccine? Was it defeating the vaccine?
No, it was spreading fast, and it was spreading in the population that was not vaccinated yet. Because remember, we were vaccinating primarily the elderly and healthcare workers, and the people who were getting sick. And I can show you something very interesting. This is from Iran Segal, who is. Give me a second to get it up. Here we go. So if you can share this, what you can see here is that the elderly, this is pretty much what we've seen the whole time. The elderly, as the wave goes up, so to speak, there's more hospitalizations. As soon as that second dose started, so the second dose here started for the elderly, but remember, it started, it didn't finish. You start seeing a flattening of that curve, so to speak. And then what happened is that people who were older, 55 to 59, started getting their second dose. So what you started seeing is that the elderly peaked right about there. See that? Right when they were getting their second dose, the first groups of the 60 plus, and the numbers go straight down. But the younger people, the numbers kept going up, and this is going straight through January and even early February. And this is because not that the vaccinated people were getting sick. You could stop sharing the screen. Not that vaccinated people were getting sick, but that unvaccinated people or partially vaccinated people who didn't have the full immunity, they were getting sick. And this variant attacks young people. We have pregnant women in the hospital. The data that we had here, and this is kind of scary because in America now, the UK variant is just starting to grow exponentially. But what we had here is we had a report a couple weeks ago. I apologize. I'm just trying to get the exact numbers for you. But
Totally
the
fine.
pregnant what?
Totally fine.
Okay.
Data
So
and numbers and graphs are actually very, very
we like
favored.
that, right?
Yes, we do.
I love it. Yeah.
Yes.
So basically, by the 21st of February, we had 50 pregnant women who were hospitalized. Okay. Um, by the last day of February, we had 37 pregnant women hospitalized, with 9 of them on ventilators or ECMO machines. And these are healthy pregnant women. Very few had pre-existing conditions. The British variant is what was found in every single one of these cases, and we didn't see this in the first wave. In the first variant, the first subtype that we had, we didn't see this. So we're dealing with a new monster. And remember, that we were not vaccinating the young people yet. So what you're seeing is a surge of young people who got it. Now we're vaccinating everybody. So now all the numbers are starting to come down. But that's the possibility for not understanding the data, because the surge happened after we started vaccinating. That's true.
Got it. So then, if I can I make this statement that now, as more people are vaccinated, more general public, youngsters are getting vaccinated, we should see in next few weeks the graphs to continue to go down.
Um, the issue that we have is that there's a separate issue going on now, which we've had pretty much a flattening of the numbers again, primarily because children are getting infected. I live in a pretty small town, and in the last, let's say, month, only 2 adults got corona, and like 45 kids got
Oh
corona.
wow,
And
really?
so it's,
That
yeah,
big?
yeah. And now our town is green. This is going back a few weeks, but there's almost no adults getting corona right now. Almost all the adults are vaccinated. My town is one of the most vaccinated places in the country. But children can't get the vaccine under 16. So that's who's getting it, and the people who are not vaccinated. So, for example, my nephew's school, half of the school went into quarantine today because there was a substitute teacher who had corona, didn't know it, and substituted in several different classes, and all those kids are now in quarantine. So that's
So
what's going on.
so that means the population, number one, children who are not getting vaccinated or not given vaccinated by design because it's not approved for them yet,
Yeah,
and so that is one group that has become now susceptible to the new variants. And
absolutely.
secondly, I'm sure that there are folks who are saying we don't want to be vaccinated.
Hmm.
Are
Yep.
there those, and what populations, what is the number there? Because if they make significant population counts, children plus this, then you would not have a very decent graph downwards.
So right now, we definitely there are definitely people in Israel who are not getting vaccinated. I'm just opening up another nice little graph for you here if you'd like to see it. But this is data from today. Actually, it's based on yesterday's data, so it's about as updated as we could get. But
Wow.
between basically it's all in Hebrew, but the numbers is what we care about. So between 50 uh, people from age 50 up are 85% vaccinated and 89% immune when you include the people who've already been sick. So that's an amazing number.
That's a
But
beautiful number.
we love that number. Now, when you look at the younger populations, you can see here this is how many people were vaccinated. So the teenagers are still less than 50%. And as you get younger, you're seeing a lower percentage. Part of that is because the vaccine just opened up to younger ages in the last few weeks, and some people are holding out and saying, well, let's see how my friends are doing and let's see what we hear on the news. I mean, we've had 5 million vaccines given in Israel, so we have a lot of data, and a lot of people are getting that first vaccine now who were sort of waiting and seeing what was going to happen. I have some friends who were waiting and got corona while they were waiting. So, they couldn't get vaccinated, the way we could. But that's what we're basically seeing here, is this nice percentage here that we like to see of people who are actually vaccinated. You could stop sharing the screen.
I have a
Um,
question actually.
sure,
So this
sure.
number, the second column, again, I cannot read the
Yeah, of
title.
course. This is okay. This is the thousands of people in the population who've been vaccinated in this age group. So 16 to 19, you're talking about 284,000 people. And
I
remember,
see.
Israel's also a very young population relative to other countries. So we have about 30% of our population is children. And when you look at the Palestinian population, then you're talking about even higher percentage. You're looking at the ultra Orthodox Jews. You're talking 40% of the population is minors, less than 16 years old. So that's what you're looking at here.
Got it.
And then these are the people who were infected. So they're immune
Hmm.
by infection by the thousands. So you could see here
And
that the young people.
got it. So then, what is that number? 11%, 10%, 7%?
This is the percentage of people in the age group that were healed, that were recovered from corona and therefore are immune without a vaccine.
Got it. So I can then say that 48% got the vaccine, 11% were already infected and
Correct.
recovered.
So it's
So a total of
59%.
59%, which is a
Correct.
good number.
Which is
Excellent.
decent. No problem.
Yes. Excellent. So my original, I'm going to circle back to my original statement
Sure.
that it seems like in a few weeks we would see a reduction, barring these groups that are not going
Correct.
to be vaccinated.
Yes. And so we are already seeing that now. We are seeing that the people in the hospitals are people who are either not vaccinated or not fully vaccinated. Remember that the numbers drop dramatically, but you're not quite at the target until you are a week after the second dose for the Pfizer. And so the people who are in the hospital, the people who are critically ill, the last data we had about the people who are on ECMO machines, we had 40 people on ECMOs, and only 2 were over the age of 60, and those were not
Wow.
vaccinated people. Everyone else was young. 13 of them were less than 40, 25 were 40 to 60.
That is serious
Yeah, yeah,
because it's not expected for the youngsters to end up on ECMOs.
yeah. And that's what's going on is we're getting more this variant is bringing us more critical young cases. Now, a lot of them have pre-existing conditions, but they're
Hmm.
still very young, and you wouldn't
Yeah,
think that that would be an issue. And the pregnant women, for the most part, they're just pregnant. They don't
yeah,
have health conditions except being pregnant.
got
So
it.
it's scary.
Hmm. So tell me this, what vaccines are actually basically used? Is it Pfizer, Moderna, AstraZeneca? What is the vaccine types that are more used?
So Israel made a deal with the Pfizer vaccine, basically, and so the vaccines being used in Israel are exclusively Pfizer, and the deal is that you're going to provide us with these. I think you presented this once, actually, the deal that they made, but you'll provide us with all the vaccines we need, and we will show you our data. We will be able to test this, and it's not just testing it. It's post testing, but we'll give you all the data. And Israel has a great way to do that because everything's electronic. We have a national healthcare system. And it was rolled out in a very organized way relative to what you could think. Um, and basically, the anonymous data, we're not tracking people. No, the government isn't, doing that. They are able to tell. They send surveys to you. When I had my vaccine, I had a survey. Did you have any side effects? It's anonymous, but I answered it. And and then they're able to gather this data and share it with Pfizer. So instead of the 30,000 stage 3, trials that Pfizer got to get the FDA approval, we have 5 million people who've gotten the vaccine. So, we have a lot more data than Pfizer ever had, and that makes that all the better. So Israel has approved the Moderna, the Pfizer, and the AstraZeneca vaccine, even though AstraZeneca is pending FDA approval, and it's not actually here yet. It's approved anyway. But they're only giving out the Pfizer, which is why they're giving the Moderna to the Palestinians. You're muted, Dr. Mubin. Sorry.
Thank you. So I have two questions. Both of those are burning questions, and we've been talking about that for other countries as well. So one question is the vaccination of those who have already become infected and recovered. And the second one is a more interesting question, and it's not about Israel, it's actually happening everywhere, and that is the conspiracy theories around the vaccine. So why not we get your first, the conspiracy theories about the vaccine.
Conspiracy theories, okay.
Right? So let's start
Yeah.
with this, that are you administering vaccine to those who have become infected and recovered?
So in Israel, they weren't doing it for a while, but they are now. So that started only a couple weeks ago, where they're now recommending 3 months after you've recovered to get one vaccine to boost your immune system. And there were people who recovered who were getting vaccinated anyway, but it was not the policy and it was not a large population. I know a few hundred kids, American students actually, who were here who got both vaccines and didn't tell anybody they had corona, and they were all fine. None of them had a problem with the vaccine. But they are now starting to give one booster for people. And so that just started.
Got it. Now on the conspiracy theories, there are so many of them, but I want to ask you this one. Somebody, actually, a couple of folks from Israel have sent me emails, and I have no way of proving that they're from Israel or they're from somewhere else. But both of them said, hey, we are forcefully given vaccines. We don't want to have the vaccines, and they're forcing us to. So what is the truth in there? And if there is any compulsion, what is that? If there is no compulsion, what is that? Why are folks saying it this way?
So there is not only no compulsion, but the government, was trying to figure out what the laws are and what the ethics are regarding mandatory vaccine policies. And there is a law on the books dated from pre-state times that in the time of a public health crisis, you could make it mandatory for people to get a vaccine. There was an ad floating around from the 1950s where everyone had to get like diphtheria vaccination, something like that. So, but that's no longer, what's going on in the world. I mean, people have freedom of choice. And Israel does not require a vaccine for anybody. Nobody is forced to. People who are vaccinated do have the ability to have more, you could say more freedoms, but you can also say less restrictions. You want to put it more accurately, is we've been living under the COVID restrictions for a year. And once you're vaccinated, some of those get lifted because you're no longer a public health threat that you could be spreading this to people. And that's very exciting. And in general, I think we have a lot of conspiracies theories here in Israel as well, and I've heard the ones that are going around internationally. But there is no forced vaccine program. That is really, really not true.
Got it. So again,
And
I'm gonna.
as you can hear, even the teacher came to school without a vaccine. Even teachers don't have to get a vaccine. And not all the healthcare providers got a vaccine. In Israel, about 80% got a vaccine. And we
So
wish it would be higher.
so does that mean that, for example, in the U.S. we are expecting that some of the employers would say, "Hey, you can't come in if you're not vaccinated." And I was sent a video by a cool bean where someone from Israel was saying that, "Hey, I am not vaccinated. I don't want to be vaccinated, and they are now asking me that you cannot come in, and my livelihood is on the line, and this is unfair." So. Are there such situations where the employers would come back and say, you know what, we need you to be healthy to come in and have vaccine? Oh, meaning, is there any, the conspiracy part in this is that somehow this is some way of damaging the population, and this is by giving vaccine, so some issues with the fertility or some issue with killing off the old folks or people with
Oh my gosh.
comorbidities. So tell me, whatever is your commentary on these.
Well, that's a few things. So let me try to get it organized. I've seen all of this, um, these conspiracies before, and we've been trying to deal with them one thing at a time. I had um, a live um, web conference with the head of the Ministry of Health Maternal Child Division, and she showed all the evidence that we have about how all of these conspiracies about fertility, for example, that's a big issue in Israel. We have one of the highest fertility, I think the highest fertility in the developed world, actually, the highest child to parent ratio. And it's a big issue here. And that it was based on a false report that was attributed to a former scientist at Pfizer. It was debunked many months ago, but it's still out there, and people want to believe what they want to believe. I know people who got the vaccine had no problem getting pregnant. I know people who were pregnant who had no problem having a baby. They're now trying to. There's early indications that there may be some immunity passed on to the fetus, and that the baby could be born somewhat immune to COVID, which would be very nice because, they can't get vaccinated. Um, I have 3 daughters, they were all vaccinated. So I think, that when you understand how mRNA vaccines work, you understand that doesn't affect that. What we don't know is how corona can affect fertility potentially. I have met people who've had corona, and obviously there are many millions and millions of people who've had corona who've had irregular menstrual cycles afterwards and other issues since they had corona. We don't know, is it related or not? There's not enough evidence. But what we do know is that these conspiracies are really, really based on fake data and fake news. And it's really fear mongering. Israel's not trying to stop the growth of its population. That would be completely the opposite of what we're trying to do. But we've had pregnant women die here. We've had pregnant women and their babies die here. And that's scary and that's very real. And remember, it's a small country. So, that person is somebody who's maybe 2 degrees away from where you are. You know somebody who knows that person because it's a small place. So that's very scary. And so pregnant women are getting vaccinated here. There are studies being done to collect that data and to get more information. Um, but what we've seen with this wave that we had with the UK variant is really that pregnant women were very susceptible, and
Got it.
that to me was that's the worst thing.
Got it. So I'm going to put a comment on the screen, and I by no way need you to actually try to defend or respond to it. If you like, you can pass on it. But I do get these kind of questions all the time as well. For example, Jax L says, give people the right to not take the vaccine. The people who get it are safe. So what you're saying is, if you wanted to be safe and you wanted to take a vaccine, fine, now you're safe. Let the others not have it. Uh, I'll give you my personal opinion. I feel that a working environment should have people all healthy and safe and protected instead of a mixture. But that is just me, Mubin. How is your policy in Israel in context, you gave me an answer a little bit before as well. Again, in this context, how would you see it?
Well, I'll give an example. People getting married in Israel in the last year have had very, very small weddings, sometimes as small as 10 people, which, if you're Jewish, is really, almost impossible to have just 10 people at a wedding. And basically, my son-in-law went to a wedding last night with 300 people. It was called a green badge event. A green badge event, because that size event is only with a green badge. Green badge means you are immune. And what they're allowing for is up to 5% of the participants to be not with a green badge, but to have a PCR in the last 2 days that shows that you don't have corona, which is not fully accurate because you can have it today and not have it yesterday, but it reduces the risk. And then if you include the fact that 95% of the participants are in fact green, the chances of that becoming a super spreading event is quite low and really close to impossible. So, and it was an incredible thing. I saw photos from it. It looked like an almost normal situation. Israel's been quite strict with the restrictions because, again, trying to avoid these super spreading events. So that's the difference. It's not that you're forced to get a vaccine. And there is a certain amount of people that they will allow into these groups. And I think that's going to become more widespread, where it's going to be a certain percentage can be without a green pass for whatever it is. I know people who had medical contraindications and can't get a vaccine. So they can
Totally
come
makes
to,
sense.
it makes sense. And you could, the movie theaters are open now, but, they're going to eventually, again, we're not quite there with the population yet, but I think what's going to happen, I know that this is policy that's being worked on, is that they're going to allow a certain percentage of people who have a negative PCR to be able to go to these venues.
I understand. Got it. Thank you very much for that comment. So there is one more. So, for example, Jack says that there is check out the adverse reactions. Tell me this. So you are the biggest repository at this time of ongoing vaccination and the adverse reactions, and all digital and all available. And even you have made a promise to make this data available. The adverse reactions, the vaccine-related deaths and vaccine-related transverse myelitis and brain tissue injuries, or what have you seen so far?
So what we've seen is, and I'm looking at the data right now, and I'm trying to get the date on this. I believe this was like the end of January, beginning of February. So it was still in the middle stages of where we are now. They basically found that of the millions of people who had had a vaccine, there were about 1,127 people who reported adverse effects. Now, remember, not everybody reports it. I mean, I report it because I'm a health professional and I know how important it is to gather, but most people who have like their arm hurting them, they're not going to report that. They expect that. But basically, most of those people, about a quarter of them said they only had localized reactions. Very few. We had some headaches, some dizziness. Everything was in line with what Pfizer said. There were a few people who were, I believe, all the people who died after getting a vaccine within, a few days of getting a vaccine were very elderly, many of them over the age of 90. And there was the investigation afterwards did not show any connection between the vaccine necessarily. These are people who had coronary artery disease and then had a heart attack. I mean, you could, even just being nervous about getting a vaccine could give you a heart attack, but the vaccine doesn't give you the heart attack.
Got it.
So there weren't any conclusions drawn, and there were investigations into each of the deaths, and there weren't that many, very few.
So then, sorry,
Go
my
on. No,
apologies.
it's fine.
Quick question then, and this is a question that was asked of me before as well, not in the context of Israel, but in the context of Netherlands and their deaths for the elderly. The question was, when I did a talk about that, and I said, look, they were already quite fragile, and then they just tipped over. The comments that came back to me were, then why to vaccinate? Why did they not say, you know what, this person is just too weak at this time? and they are too fragile, let's not give them vaccine. They cannot take the after side effects. Is that something that has become part of policy now?
So it hasn't become part of policy because remember how badly internationally the elderly were just killed off. I mean, in Italy, in many areas of Europe, even in New York, you could see what was going on there. And once COVID hits an old age home, it just wipes them out. I mean, the death rate is so high among that population. And when you look at that compared to anything that happened after a vaccine, and remember, we have a large percentage of our elderly are vaccinated, and very, very few, I'm talking about less than 10, have died. And within that period of time after the vaccine, obviously, people who got vaccinated in December could be dead now if they're, old. Um, but um, relative to what would happen if COVID came into their facility, I mean, you can't compare that. You can't compare the
Got it.
death rates. And
Got it. Got
so,
it.
yeah,
Understood. So one more time, I'm going to talk about the green passport. We have talked about it a few times, but I
yeah,
wanted to create a concentrated part of the discussion. So the green passport, tell me more about that. What is it? Is this a way to kind of separate some people from other people to say what is the green passports concept and how are you using it?
absolutely. So it's a very exciting concept, actually, and a lot of countries are now trying to follow up with what we're doing. We just had the Chancellor of Austria and the Prime Minister of Denmark here looking at our green badge with the Prime Minister to see how we've implemented it. The idea here is that, like many countries in the world, the economy in Israel has suffered. I mean, for months at a time, restaurants are closed and tourists aren't coming, and the stores are closed. Everything is closed. And you have to find a way or a balance for people to be able to live and to make a living and to go to work. And at the same time, to be able to prevent public health catastrophes from happening. So the vaccine allows us to do that. And so what we're trying to do is to prevent these super spreading events. We're trying to reduce the public health risk. And the green badge is a way, it's a way for you to be certified as being immune. So people who've had corona, they can get a green badge. Eventually, people with serology will be able to get a green badge. They're working on that. Um, and that means that the parts of the economy that have been shut down may be opened up. For example, tourism. Tourism is pretty dead around the world right now, as we know, and it's a very big part of the economy here in Israel. So Israel, for example, with the Green Badge program, has now opened up its borders to Greece and Cyprus. I mean, right now, Israel's still not allowing foreigners to come in. We're in a specific stage right now where we're not doing that. But it's going to be open to Greece and Cyprus soon for the green badge. You show your green badge, and that means that you don't need to do quarantine when you go to Greece or Cyprus. And when they come to Israel with their green badge, they won't have to do quarantine either. So it just opens up the world to us. It's not a segregation thing. It's not supposed to be about that. It's about being able to reopen in a safe way and an intelligent way. Um,
Got
people,
it. So I was
okay.
thank you very much for this, and I was reading some comments here as well. I've been sent some comments before as well, and this is probably a little unpleasant, but I have been hearing this, and I wonder it. So I'm going to present what I wonder. Why would Israel, within within Israel, try to separate one population of its own Jewish people or Arab and Jewish people or its citizens from others? Why would it want to do that other than this safety or protection? What could be? I don't see a reason for a country to do that to its own population, to say, you know what, some people are separated and others are separated. Um,
Correct.
so that's my take. I have one
I
more.
agree.
So one more question here from Stephen Westman. Have experts in the region developed any proposition regarding why some individuals were far more susceptible, blocking for age and pre-existing? So is there? a knowledge that there are sometimes people who overreact? Do we know why?
Um, there is no rhyme and reason for why some people get bad cases of corona, besides the factors that he already mentioned, the pre-existing conditions, the age, and the pregnancy. Besides those, there's no rhyme and reason. I've seen perfectly healthy people be asymptomatic. I've seen people with pre-existing conditions be asymptomatic, and I've seen people who were healthy athletes get really, really sick and end up in the hospital. And by the way, neither of these things has anything to do with your post COVID or your long COVID, whichever term you like. I like post COVID better, but the conditions that are coming out after you have corona and the long term implications have nothing to do with how your case of corona was. You could be asymptomatic and then get a really bad case of long COVID where you can't walk around the block.
Got it.
So no,
Got it.
no rhyme or reason, and right now can't figure it out. No one
Got
can.
it. Got it. So thank you very much for this main body of the discussion. You've been with us for almost an hour. It's getting late there as well. I want to answer some of the questions from the cool beans too. So if you can give us some more time, I would like to have some questions from Twitter, some questions for live. Is that doable?
Sure.
Okay, excellent. So, cool beans, do me a favor. The one who are live here, please do put Q with your questions so I can filter them. And I'm going to start with some of the Twitter questions, just so that Twitter followers don't become too upset that their questions are left behind. So this, I think we have already answered. Medjas Kemet says that there is some sort of a segregation going on. So I think we've discussed that multiple times today. And I am also going to skip over questions that are not related to vaccine or the vaccine outcomes. For example, ivermectins or, for example, other things. And we discussed this, Eliana and I, that let's keep it focused on the vaccine. We can request her presence once again if needed later on. So here is a COVID breathalyzer. I'm going to continue to go. Are lockdowns that destroy Israel's economy and many lives preferable to allowing people to take ivermectin, especially? So again, Joe Smith, I understand this is on the ivermectin side, especially when emerging variants show the basic question over here is, uh, are vaccines going to be really beneficial? And if not, then are we just going to stay in lockdowns forever? And my apologies, we have two cats. One of them is Luffy, and he has just appeared here, and he's going to chime in too. So, lockdown or vaccine, are vaccines working?
So, what I could say is that our last lockdown did not work very well when we had this surge of the UK variant. So, I think the way that things are going to work going forward is going to probably be different in Israel. I think that it's important to note that the lockdowns that Israel did have worked very well in the past and that other countries have followed suit. We were the first country to go into a lockdown in March of 2020. And it did work. One thing that the lockdown did successfully do is it prevented us from having a healthcare crisis in the hospitals and healthcare system. That's really the main benefit that we had. The cases still went
Got it.
up. That did not work, but there was a benefit, and I think it's going to be different going forward.
Got it. And Joe, I'm going to skip over your hydroxy question as well. I want to stay on the vaccines. So Joe has one more question. I think you have answered that before as well. And that is, why vaccinate when the youngsters are actually better protected already? But you mentioned that youngsters are actually, with the new variants, they're not that safe.
Yes, so that's true, and also they're spreading it.
They're
So
spreaders too. Got it.
yeah.
Okay, a couple of more questions, and I'm going to go to the live side. Uh, wouldn't it be a better policy to vaccinate only the people at high risk of hospitalization or death, and then open the economy and let herd immunity develop? So,
Well, if you take a look at that question, we have children who are on ventilators in Israel. So in the previous variant, you might be right, but in the current situation that we're in, and America is now at about 20% with the UK variant with exponential growth, and it hasn't really hit America yet in that way. But once you start seeing young, healthy people who are getting sick and getting critically sick, it makes a very big difference in your policy development.
got it. Makes sense. Sorry about that. Then one more question here, and then I'm going to go to live. So Michelle says, "You're amazing." Now let's see. You get someone from. Okay, so Michelle will
Yes.
do.
Sorry for
So
not being Dr. Fauci.
this is a question for you as well, Eliana. You are amazing
Sure.
as well. All right, so I'm going to go to the live side, and folks, I'm not going to ask about hydroxy or ivermectin or other. We can ask her to come in at a different time. I wanted her to be super prepared with the vaccination, and she's already so much already prepared. Tell me this. There was a question I just saw. What are the total number of deaths due to vaccine? So there is a underhanded
Yeah, it's a
takeaway
little bit
here,
of a biased question.
right? So
Um, so there
yes,
haven't been any deaths that have been implicated because of the vaccine directly in Israel that we have seen.
got it.
There have been people who died, but it's not been a direct consequence of the vaccine. So, for example, we've had allergic reactions, but no one's died of an allergic reaction. That
Got
would
it.
have been from the vaccine if they did, but they didn't.
Got it. Got it. So I'm going to actually stop sharing for a second so people can actually see you. So here is another question from Aaron. Aaron has been a cool bean, I think, for a very long time. Thoughts regarding Pfizer's original vaccine as it relates to the proven antigenic escape with mutations in these two mutations in the RBD as demonstrated in Manaus. So he's saying that in Manaus there has been mutation that escaped Pfizer's vaccine. Are you seeing such a situation or
So,
possibility?
right now in Israel, we have very scant amounts of the South African variant, the New York variant, and the Los Angeles variant. Not too much of the Brazilian variant right now. Those variants have all been shown to be resistant to the antibodies and resistant to the vaccines to a certain degree of not completely, but to a certain degree. The efficacy is lower, but this is not a prevalent so you can have different mutations going on at the same time, but in our case, there's one that's prevalent right now, and that can change. But right now, the UK variant really spread much faster. So you can have, thousands of variants going around, but the prevalent ones is what's going to make a clinical difference in your decision to administer vaccines. The other thing is that our green badges, for example, are only valid for 6 months because we realize that with the variants going on, you may need a booster, and
Oh,
we don't
wow.
know how long the immunity lasts. So it could be that at 6 months, that will just get an extension. And it could be at 6 months, they're going to say, you know what, now we have the South African variant here, we need a booster. And
Oh,
Pfizer
wow.
is prepared to do that as well. Yeah.
Oh,
So
wow. Very interesting. The idea of the booster. And today, when you are saying that 3 months later we are offering booster, is that for example, for Pfizer 2 dose, are you just giving 1 dose or you're going to give both doses for booster?
that's for people who've had COVID, and 3 months later we give them one vaccine just to boost their immunity.
Got it.
And so that's what's going on right now. In terms of what it's going to look like when we need to potentially revaccinate, because most epidemiologists and public health experts believe that COVID is here to stay for a long time. This is going to be something that we're going to have to deal with. And it could be that we'll have annual vaccines like the flu. And we're hoping it gets to that level. And but what it means is that once the new variants become more prevalent and we have another vaccine booster, we don't know if we're going to need one vaccine or two vaccines. Chances are probably one because we already have immunity. So a lot of these vaccines that are approved that don't work in South Africa as well, they do have some efficacy, maybe 50, 60, 70%, but not 95%. So if you get one booster with the correct variant and the correct mutation accounted for, then that could boost you back up.
Makes sense. Makes sense. So tell me this, and this is a thing that we have been talking about for a long time. Any data on reinfection rates with new variants?
So in Israel, there have been very, very few cases of reinfections. So again, we have the most experience with the UK variant in terms of the new mutations that are out there. And what we have found is that people who were previously infected with the mainstream, I'm calling it mainstream corona, I don't know if that's a thing, but the original strain of corona did not get reinfected with the UK variant. So we have not seen a lot of reinfections here. although we're prepared for it. So
Got it.
that's
Got it.
part of the reason why we're giving the booster to people after they've had corona, is just to boost their immunity a little long, because we know that coronaviruses, the immunity is not long lasting, that after a certain period of time it does wane.
Got it. Thank you. So Sandy, DIY health advocacy. So thank you. Are Israelis being advised to continue wearing masks and social distancing until they approach herd immunity? So I think I'm going to add to her question, those that are vaccinated and those that are not, is there a difference?
Yes. So, Sandy, I love this question because I talk about this all the time. So, basically, the rule here in Israel, and you know, having a rule that's enforceable, it means that you need to have some kind of universal rule, because you're not going to have police on every corner saying, "Are you? Do you have a green badge? Do you have a green badge?" when you're looking for people who have masks on. So, right now, the policy is that we're still doing masks and distancing in public, if and that's the policy, okay? But when people are in private and in an environment where everyone has been vaccinated, they're not generally wearing masks because you're not really going to spread it. We've now seen that the early data is showing us that you don't spread it nearly as much as they originally thought after a vaccine. And so people in private places are now able to take their mask off. For example, we now have restaurants open to up to 100 people. You can't have a mask when you're vaccinated. So, but that's only for a green badge. So if you don't have a green badge, then you still have to wear your mask, or you eat outdoors in the restaurant.
Got it. And this is, I'm just being, I think, facetious here to put this comment up as well. That is because Jax is being facetious here. So concern is there. And so you saw Jax's previous questions as well on the vaccine side. So he's saying, well, once again, death after vaccine is always from natural causes, fact checked by Pfizer. This is more of a sarcastic comment. Do you, so the folks, again, look, I may be wrong here, but I really believe that any country who care for their population, and I believe Israelis care for their population, I fail to understand that why would they allow something that would hurt their population and then try to hide it. I think if that was the case, they would actually be the first ones to say, get this thing away from here. This is hurting us. Eliana, am I wrong in thinking this way?
No, you're not wrong. And actually, Israel's having elections in about 2 weeks. So this would be the worst time for any politician to advocate in an immunization that was harming people. So that's absolutely not true. We've seen a tremendous difference in what's going on here in terms of reopening and safety and the numbers coming down. The people that are in the hospital are not vaccinated. The vaccinated people are very rarely being hospitalized. And it's the difference is when you look at the data pre-vaccine, in the middle of the vaccine, after one vaccine, and then after the full vaccination program, you're seeing just so many lives saved. It's incredible. And so I think that there are hardly any people in Israel. Obviously there are people who are against vaccines in general, but I think there are hardly any people in Israel who can't look at the data and say, wow, this has been like life altering. This has saved so many lives. So we're very happy about that.
Got it. Jenna Taylor, she's a cool bean as well for a long time. Question, were the kids vaccinated that are on vents?
No.
And kids under 16 are not generally vaccinated, correct?
Correct. But even the young people who are critically ill were not vaccinated. There were very, very few people who had full vaccines who were critically ill, and the numbers are much lower. But the young people and all of the young people who have died, young people meaning under the age of 50 at this point, but none of them had a full vaccine program. A lot of people got COVID after the first vaccine because you're not really immunized yet. So, but that's because we were in the middle of the surge.
Got it. 10 AE 812 says, how do we distinguish from herd immunity versus vaccine efficacy? So how are you measuring that? That here are the people who got vaccine, and that is why they are safe and effective and protected. And here are people who are becoming infected. Are you able to count asymptomatic patients as well? Is
So
there a
there
way?
is there so there was a great study that was done in Israel in old age homes where people were vaccinated, and then every week the healthcare workers were vaccinated, and then every week they were tested for COVID as part of the study with or without symptoms, and they found that a huge number of people were not getting corona, and the few people that did were generally not even symptomatic. And remember, this was all going on. I'm talking about 80% reduction of cases compared to the healthcare workers of other facilities, let's say. But there are some population screenings going on. At this point, the numbers are getting lower, and the positivity rate is getting lower as well. I think the main problem with herd immunity is that with a population like Israel that's very intergenerational, I have grandchildren, I'm very young, I have grandchildren, and there's almost nobody who's isolated in their own little one like age group bubble. So once you have that, and remember that 30% of the population cannot be vaccinated, you know,
Got it. Got it.
we're never going to get to herd immunity until we take care of the children.
Makes sense. So the house says, what is the standard of care for the young ones? And there may be multiple. What are you aware of?
In general, in Israel, the standard of care for people who have mild cases of corona, and most people who are young have mild cases of corona, is just, managing at home with over-the-counter medication and monitoring. And remember, everyone in Israel is part of one of the four healthcare companies that um, is part of the healthcare system in Israel. So when you have corona, they're actually calling you and monitoring you. If you're a child, they're calling your parents. A lot of them are sending pulse oximeters to the house for you to monitor, and the nurses are calling you. So you are taken care of remotely, but the treatment generally is just managing the symptoms, and that seems to be working. We have a very low death rate relative to other countries taking care
Got
of
it.
it like that.
Got it. Got it. Um, One more question. Are any of the vaccinated getting long COVID? Meaning, is vaccine itself causing any damage in terms of immune system, cytokine storms, or longer lasting negative effects?
There hasn't been any documented long-term effects like that I'm aware of. Um, and certainly nothing that's come to light. There might have been one case here and one case there, but these are not, 5 million cases. That's very, very small. I personally have not heard of that. Um, of the people I take care of who've had corona, even I take care of mostly students and young people, about 25% have long COVID.
Got it. Cool.
Yeah.
So just a couple of more questions from Twitter, and then we break. So Cool Beans, I want to be mindful of the time from Dr. Aaron as well. It is more than an hour. So a couple of more questions from Twitter, and then we can request her to join us again if you have more questions. I definitely got a lot of clarity on some of the vaccine related and the graph related changes that I was kind of surprised that they're not happening. So let's see here. This is about vitamin D. Just by the way, I know that we had discussed to stay on track for vaccines.
Sure.
Do you use vitamin D there, or are people aware that vitamin D is useful and should be taken?
I've been advocating for people to take vitamin D since the first lockdown in March, just for the fact that they were indoors. And so I've been doing it, my family's been doing it, and a lot of people who follow me have been taking vitamin D. We also have been recommending it to people who have corona. I didn't include that in the treatment because that's over the counter, but we do recommend vitamin D. There's very little downside, and actually, most people are somewhat vitamin D deficient anyway, so it's not going to hurt them.
So then, if you don't mind, and if you want to pass on this question, please do. What dose of vitamin D do you take?
I take 5,000 units 3 times a week, but we recommend 2,000 units a day.
Got it. Got it. By the way, I take 10 to 20,000 units a day, but that's
There
just
you
me.
go.
Please don't follow me. Got it. um, so there is a question. I think most of these questions you have already answered. Any data on how Pfizer holds in the communities where South African variant is taking over? Uh, is there any data on that?
I don't think that's been tested yet. I think there are some tests going on now, but we have some data from the Moderna that I think was tested there. There is a reduced efficacy rate, and we're anticipating it will be the same for the Pfizer since it's a similar type of vaccine. So I would probably estimate at 60, 70% efficacy as opposed to 95 plus efficacy that we're seeing.
Got it. One last question. And that is, I think I like this question. Kristen says, should long haulers get the vaccine? So there are people who got infected, recovered, and you're giving them boosters. Some people just become long haulers. They just keep having symptoms.
For sure, and we actually have had a large amount of again students. We take care. My company takes care of students in Israel. We've had a lot of students with what we call long COVID or post-COVID syndrome, who have had the vaccine, and it has not exacerbated their symptoms. However, there are some people who have very critical cases of long COVID, and I would speak to your doctor about it before doing anything else. So that would be my advice.
Got it. Cool. So thank you very much. And Carolyn, I know that there is a question from you about ivermectin. There are so many cool beans who wanted to ask about ivermectin and hydroxy. I'm seeing them here. Carolyn, I'm not ignoring you. It's just that I wanted to make sure that we talk about vaccines here. If you wanted, and if Dr. Aaron had time, we can request her to come back again. So Dr. Aaron, thank you very much for your time. I know it is late there, and I know you still have to work on the data as well. So thank you very much for being here.
You're very welcome. Thank you for having me. Stay
And
safe, everybody.
You too. So cool beans, thank you very much. And do you want to do a chit chat now, or do you want to do it 6 o'clock, or do we meet tomorrow? So just do some commentary there, and I'm going to go offline for now.